Hey, I'm out and about with my family today, but I have some very interesting things to share with you about health insurance on this edition of One Star, One Texas. Hi, this is Tom Cantrell. Did you ever wonder how health insurance got started in the first place? Well, it wasn't started by a huge investor-owned corporation somewhere up north. It was started in Texas, in Dallas, by a group of school teachers.
If it hadn't been for a former Dallas school superintendent and a group of Dallas teachers, modern health insurance in the United States may not have been created. In 1929, Justin Ford Kimball, a former Dallas school superintendent, became the official in charge of Baylor University's Dallas hospital units. His idea became a reality when a group of Dallas school teachers contracted with Baylor Hospital to provide up to 21 days of hospital care by contributing 50 cents a month into a fund. From that beginning, the organization we now know as Blue Cross Blue Shield was born. In the 1940s, President Harry S. Truman attempted to pass legislation that would provide affordable medical and hospital care for the elderly, but it failed. On July 30th, 1965, that dream finally came to fruition when another notable Texan, Lyndon Baines Johnson, signed legislation that created Medicare and Medicaid. LBJ had placed the issue high on his agenda in his State of the Union message in January 1965. 3 days later, he urged Congress to pass Medicare, demanding that America's seniors, quote, be spared the darkness of sickness without hope, end quote. With Texas historically on the vanguard of healthcare coverage, you'd expect them to be at the forefront today, but that is not the case. In fact, Texas has the highest population of uninsured in both real numbers and as a percentage of the population of any state in the United States. In 2015, there were more than 4.3 million Texans without health insurance, including 623,000 children. This is nearly double the national average. Approximately 1 in 5 Texans, including over 50% of the Hispanic population in Texas, lack insurance. Some believe that undocumented immigrants are a drain on the Medicaid system, but this is untrue. In fact, undocumented and legal immigrants cannot enroll in Medicaid. Proof of citizenship is required. Medicaid does provide emergency services for both undocumented and legal residents. Over 60% of the working-age uninsured have a job, but it doesn't offer health insurance. Unlike many states that cover low-income populations they are not required to cover, Texas does very little and mostly stays to the federally mandated minimums. There is limited regulation of insurance rates, and Texas doesn't seem to have the stomach for it. Texas also has a large immigrant population, which tends to have a higher rate of uninsured than non-immigrants. If you're wondering how Texas ended up in this mess, you don't have to look very far. Now let's get to the heart of the matter. The governor, lieutenant governor, and the Texas legislature need to rethink their priorities. For a bunch of folks who profess to embody high family and religious principles, it's absolutely immoral for them to be wasting Texas taxpayers' time and money on useless legislation like bathroom bills, crackdowns on undocumented immigrants, school vouchers, and more. They should be focusing on fixing the hugely embarrassing situation of the uninsured in Texas. Given Texas' contributions to the concepts of health insurance during the past century, we should be at the bottom of the list of uninsured, not the top.
If you've enjoyed this video, please like it, share it, and help spread the word. Also, please like the One Star, One Texas Facebook page and YouTube channel, and check out my website at onestar1texas.com. For One Star, One Texas, this is Tom Cantrell. And remember, resist, persist, now go make it a great day.